All right, let's get started. I just want to start off by saying good afternoon, everyone, and welcome, and thank you all for joining us today. We are excited to have you all. I just want to start by saying this webinar will be recorded. I also would like to introduce today our speakers, Katie and Felipe from Gold Kidney. Katie will be going over the Florida market, and Felipe will be going over the Arizona market and share some valuable information with us that Gold Kidney offers. So please join me in welcoming Katie and Felipe. The floor is yours.
Oh, thank you so much for the warm welcome. Good afternoon, everyone. Thanks for joining us this afternoon to learn more about Gold Kidney Health Plan. My name is Katie Strout. I'm the sales director here in Florida for Gold Kidney, and I'm joined by my counterpart, Felipe Valdez, director of sales in Arizona. We're going to give a more formal introduction of ourselves and our local teams as well in the next few minutes. So, some of you on the call, you may or may not be familiar with Gold Kidney Health Plan. We are a Medicare Advantage carrier. We have a laser focus on serving individuals on Medicare with the chronic illnesses that oftentimes lead to or go hand in hand with CKD or chronic kidney disease. Think of conditions such as cardiovascular disease, CHF, diabetes, individuals who unfortunately have end stage renal disease and they're on dialysis. So we're going to be spending, I would say, about the next 45 minutes or so diving into how our CSNP or chronic special needs plans not only provide you as the broker an opportunity to grow your book of business year round, but also to really help your client base with chronic illnesses receive the benefits and care that they need to improve their health outcomes and their quality of life. Just a little housekeeping as we get going here. Everybody is muted. However, you still do have the ability to use your chat. So if you have questions, please feel free to type them in the chat box throughout. We're going to try to monitor it as we're presenting and address questions as they come up. But also, if we don't get to your question during the presentation, we will be covering some of them at the end as well. So this is our agenda for today. Over the next 3 hours, I'm just kidding, over the next 45 minutes, we are going to be meeting our teams both in Arizona and Florida. We're going to talk about who is Gold Kidney, what is our mission, what is our purpose. We're going to be giving you an overview of the CSNP opportunity for you as a broker and again, how you can help your clients. A lot of people don't know much about CKD. We'll talk more about it, but they actually call it the silent killer because a lot of people don't know they have CKD, but they have the conditions that go hand in hand. So we're going to talk more about that. We are going to highlight some of our market specific benefits in both Arizona and Florida. For newer brokers to CSNP, and by the way, we'll mention this as well, but CSNP is the fastest growing segment in Medicare Advantage today. So we're going to talk about some ins and outs with the verification process because that's important to know. And then we're going to talk about the broker experience. What you can expect as a broker working with Gold Kidney. So with that, I'm going to turn it over to Felipe to introduce his team in Arizona.
Absolutely. Thank you, Katie. So as you see, that is me right there, Felipe Valdez. I am the sales director for Arizona. And then we have two other people that you may contact if you're working here in the Arizona market. David De La Torre is the market manager, and he services all counties here in Arizona. And Kimberly Chavez, she does provider relationships as well as events for us. So if you have anybody in the Arizona market that is interested in working events, Kim is your gal. So that is the Arizona team.
Great, thank you. And in Florida, of course, I am the sales director in Florida. Like Felipe, I've been in the industry for quite a while as a broker, as a market manager, and we're both coming, Felipe, I think we're both coming upon our 2-year anniversary soon with
Yes.
Gold Kidney. So
Yes.
been in the industry a while, but a couple years with Gold Kidney. You can see our market managers up here on the screen. We support you from a national down to a local level. At the local level, Ray Gomez and Mario Unco, they are your market managers. They cover quite a lot of territory. I call them the dynamic duo because they basically cover the Treasure Coast down to Miami-Dade counties, and they do a great job of it. Justin Hall, he's our market manager in the greater Tampa Bay and the counties, the few counties, we'll show you a map in a minute that we have in the Southwest Florida area. And I always say Miss Daneria Kamore, she is our market manager up in that Northeast Florida area. So we're here to help you. We can send this presentation out after. Please don't hesitate to reach out if you have questions or just want a business plan, anything you need. I'm going to go into our story and our deep purpose. So, Gold Kidney Health Plan, as I said, we're a Medicare Advantage only carrier focused on chronic special needs plans or C-SNP plans. We are headquartered closer to Felipe out there in Scottsdale, Arizona. We are coming into our fourth AEP here soon out there. We're coming into our third AEP out in Florida. Gold Kidney. So we were started by a group of over 100 nephrologists throughout the United States. And these nephrologists are meeting with patients that are chronically ill. Not only do they have CKD, but again, some of those conditions that go hand in hand. They're meeting with their patients every day, realizing that their patients didn't really have a health plan that met their needs or that meets their needs. A lot of high out-of-pocket costs. They're going to the doctor a lot. Maybe their medications aren't covered the way they need to be. They take a whole list of high costing medications. And a lot of these patients, as you know, in the field, struggle with other social determinants of health. Maybe they don't have transportation to get to the doctor. Some of the nephrology patients, they go to dialysis 3 times a week. And if they don't get there, they end up in the hospital, right? People can't afford utilities, and maybe they don't have anyone at home to help them. They don't have any TLC at home, care management, family members to help. So these nephrologists came together and they formed a Gold Kidney Health Plan. And again, these Medicare Advantage plans, the benefits, the care, the medication coverage, everything is tailored specifically towards the individuals and with the conditions that are joining the plans. So we're going to tell you more about the benefits and how they're uniquely tailored towards these individuals. But the whole purpose of Gold Kidney is to come out with plans to help improve the quality of life and slow disease progression for the individuals that are on the plan. So we're going to tell you more about that. But before we really get into the nitty-gritty, we wanted to talk about where we are in Arizona and Florida. Do you want to cover Arizona first, Felipe?
Yeah. So, if you're not familiar, there's two large cities in Arizona. Maricopa being the one that hosts Phoenix, and then Pima County is the one that hosts Tucson. So those are the largest metropolitan areas. The rest of the state's pretty rural. But we started off in Maricopa, Gila, Pinal, and Pima, and this year for 2025, we expanded to some of the rural areas up north and down south. So that's Bocanino, Navajo, Graham, and Cochise County. So for a total of 8 counties here in Arizona.
Awesome. And in Florida, on the map again, we started out in the just 9 county area. And in 2025, we expanded and now we're in a 22 county area in Florida. There's about 3.5 million Medicare eligibles within our footprint that we could possibly serve with one of our plans. And we're going to tell you how prevalent some of these chronic conditions are later. But spoiler alert, about 40 to 50% of Medicare eligibles in both Arizona and Florida qualify for one of the C-SNP plans that we offer. In Florida, we'll talk more about it as we go through, but we're doing very well. And actually in Florida and Arizona, year over year, we grew about just over 400% with our membership during this last AEP. So really, for 2026, we have our first looks. Be on the lookout for invites, but we're going to have our in-person and virtual first looks in August. It looks like we're really staying within Arizona and Florida, getting our roots in the ground, continuing to improve member broker services, and just really focused where we are now. So, but if you have questions on the counties we're in, maybe opportunities where we do very well, let us know and we're happy to help you after this. I'm going to turn it over to Felipe just to tell you more about the different types of plans we offer, the main types of plans in both states.
Yeah, so what you'll see is that our plans are designed for a few different chronic conditions. As you may know, there's a lot of different chronic conditions which you could build a SNP plan around. But the ones that we have in Arizona and Florida are specifically for those that have cardiovascular disease, congestive heart failure, diabetes, and individuals that are undergoing dialysis. And that's a really important part because sometimes you can have somebody that's very close to end stage renal disease or stage 5 chronic kidney disease, which we'll get into in a bit. But the important thing for you as an agent to know is, are they on dialysis? That's the easiest way to know whether or not they would qualify for our plan. So beyond just those chronic conditions, we also have plans that are built around those that have Medicaid as well as Medicare, right? So we're diversifying the population that we work with. As you can see, our CSNP plans, we have our Gold Heart Diabetes plan that is for those that don't have a Medicaid plan, and then the Gold Diabetes Complete. When you see Complete, that's our lookalike plan. That is the Medi plan that we have for them. So you'll see that also for the dialysis plan as well. You'll have a regular Gold dialysis plan and then a Gold dialysis Complete plan. So when you see Complete, that's basically for the Medicaid population. Now, some of the things that we have on our products that distinguish us, obviously CSNP's kind of a universal thing now, right? In terms of year-round enrollment. We're seeing a lot more people wanting to get in the CSNP market. We've seen growth, but guess what? We've been doing it for a few years and we're pretty well established. And we also don't have all 16 conditions we're trying to do, right? We're really hyper focused in with this population, which has a huge overlap with people that you talk to every single day. We feel like we have pretty innovative benefits. You'll see that we have a cell phone on our plans, and we have a few other things that are specifically for this population. And having those close ties to the providers, to the nephrologists that started us, really resonates in the benefit packages that we provide. Also, given the population, we have a big emphasis on making sure people have what they need. That includes insulin and diabetic supplies. So that's really important to us as well. And beyond all of that, the way we can maintain the population that we work with, which is very, very people that need a lot of attention, is we provide care management and other things that help members be healthier. A good example, somebody gets discharged from a hospital. We have an organization that helps them go over their medications to make sure that we consolidate them and we're not taking duplicates of medicines that have different labels, but they're the same thing. And now you're taking double dosage. Little things like that go a long way with making sure that we're not releasing people from hospitalization only for them to come back 48 hours later. So we feel like we do a good job in that respect.
Thanks, Felipe. So we're going to just talk about some CKD or chronic kidney disease basics. Before Felipe and I worked here, we didn't pay too much attention to some of this, but we didn't realize how prevalent CKD and some of the conditions that go hand in hand with it were. So we just want to tell you a little bit more about it so you understand the population of individuals we're trying to serve. So about your kidneys, most people, if you didn't know it, you're born with two kidneys. They're located on either side of your spine, in the lowest area of your rib cage. Each kidney is about the size of your fist. I thought this fact was interesting because a person can actually live a normal life with just 1/4 of a kidney functioning. Kidneys are important because they remove waste products from our body. They remove drugs from our body. They control the production of red blood cells. They balance our fluids. They do so much. So when we start to lose the functions of our kidneys, other things sometimes, other conditions can occur as well. And that's what we're going to talk about. So as I mentioned, a lot of individuals don't even know they have CKD. There's 5 stages, and Felipe is going to cover them on the next slide. But a lot of people don't even know they have CKD until they're in a later stage 3. But what they do know they have, diabetes and hypertension, those account for approximately over 70% of cases. So we mentioned that we have a CSNP plan for individuals that have diabetes, as well as cardiovascular disease, because that's very prevalent as well. More than 1 in 3 adults have at least one type of CVD. So if we could provide the benefits and care to slow the disease progression, then it could help the kidneys as well. So we try to provide the benefits to really help out with those other conditions as well. So there's about, I think we're at 37 or 38 million adults in the United States that have CKD. And again, 1 in 3 are at risk, don't even know they have it until they're in a later stage. So it's really eye-opening to me to know how many people have CKD or are developing it and don't even know it. So Felipe is going to kind of tell you about the different stages and some of the tests that we can have done at the doctors to see where we are on this chart.
Yeah, it's funny because you hear people say, I have diabetes, I have a heart condition, what have you. But not many times you hear somebody say, I have chronic kidney disease stage 3B, right? You don't hear that. You don't your eyes don't gravitate towards the EGFR. You might when you get a panel done at your doctor, you might be looking at your lipids and what have you. But it's such an important disease to track and make sure that your kidneys are functioning correctly. Everybody's going to face some form of CKD at some stage in their life. If you're over the age of 40, your kidney function starts going down. So it's important to maintain your kidney function as much as possible and not doing anything to exacerbate that, right? So how do you look that up? So you look it up with your EGFR. That will tell you what your kidney function is when you go get a panel done, right? So stage 1 is 90 or greater, right? That means your kidneys have no deterioration of their function. Where you want to really start taking note of things is stage 2, because after that, you're really trying to get some kind of medical intervention to track it, right? So your EGFR between 60 and 89 is what stage 2 is. Then stage 3 is in 2 sections, 45 to 59. Then you have 30 to 40 in stage 3B. Stage 4 is now where you're going to the nephrologist often just to make sure everything's okay. You might be taking medications. And you also might be getting symptoms of what happens when you go through end stage renal disease. The metallic taste in your mouth. You may be having an issue balancing fluids, meaning like you're retaining water. And then EGFR less than 15 means that if you are you're basically to go on dialysis, right? You have to go to an in-center. There's other options that you could do, like home hemodialysis, which if you're comfortable with needles, you could do. Most people opt to go into an actual facility, and that's 3 times a week, for 4 hours at a time. And it's exhausting. So, it's a very, very difficult disease to deal with once you're there. Our hope is to slow down the progression of CKD in most of the members that we have. And if you're stage 5, which you're full-blown ESRD, meet you where you're at and provides things like transportation, provide things like access to food, affordable healthcare, right? All these things are determinants of health, especially for this population. And if you're young enough or eligible for a transplant, stage 5 is where you'd be eligible. You'd be going through dialysis, and then following whatever the transplant procedure is, if that's what you qualify for. And that's always a possibility if you are full-blown ESRD.
That's a great explanation, and I was alarmed. Felipe mentioned it, but one of the physicians that we talk with often, he pointed out, and Felipe doesn't have to worry about this yet, but I do, that once you hit the age of 40, you lose 1%, even if you're healthy, 1% of kidney function every year thereafter. So if you couple that with some of these chronic diseases, that affects it as well. And as we know, about 90% of seniors have one or more chronic conditions that really could contribute to the different stages here of CKD. And a lot of people, because they don't go to the doctor like they should or have these tests done, and for different reasons, maybe they just don't go, or maybe they can't afford to go, they crash into dialysis because of that, and they don't realize it until it's later on. So it's really interesting. But when we focus on the Medicare world, if you've been doing this for a little while, it's only been since the year 2020 that individuals on Medicare could even join a Medicare Advantage plan. And what we see a lot of is some of these individuals on dialysis, they're on a standard Medicare Advantage plan with another carrier. Yes, they can be on that plan, but they're paying 20% for dialysis 3 times a week. They don't have transportation and some of the care they need. And that's why we offer a variety of plans, but that dialysis plan is my absolute favorite. Not as many people qualify for it, which we'll talk about, but if they do, it could be life-changing with the benefits that we offer. So that brings us into the C-SNP opportunity. And I kind of mentioned this at the beginning with Gold Kidney Health Plan, we are a C-SNP plan. So if you're a newer agent and you don't maybe know the election periods for C-SNP plans, there's an election period year round where people could join the plans that we offer. And again, if you're somebody like me, I have a social work background, and I know a lot of people on here probably just want to help your clients, right? I always want to help people. And I feel like special needs plans, whether it's the duals or the C-SNP plans that we offer, we have the opportunity to make a difference with our clients and in the community, and we can do that together. So Felipe mentioned this at the beginning as well. We're all overseen by Medicare, right? Medicare tells carriers you have the ability to develop C-SNP plans around 15 different conditions. We don't have to, right? We only, as Felipe said, we work with those with diabetes. It can't be pre-diabetes. They have to have type 1 or 2. CVD, cardiovascular disease, CHF, or individuals with ESRD on dialysis. You'll notice in different parts of the states, there'll be carriers that COPD is a popular one, or even HIV. There's all different plans, but you're going to see from 2025 into 2026, that 15 is going to increase to include some more conditions, which we'll talk about at our first look. Which I think we can mention one of them now, right, Felipe? Um, we're CKD is actually going to be one of the new conditions, which
Yes.
we're going to obviously have a lot of experience with and be able to help individuals not just on ESRD, but that maybe are a stage 3 or 4 and they're not quite on dialysis. So that's exciting for us. The second bullet point's kind of eye-opening. If you look at individuals on Medicare, there's just over 65 million, right, throughout the United States. 32 million of them, almost half, qualify to be on a C-SNP plan for heart and diabetes. So a lot of brokers will say, well, how do we find the individuals to go on your C-SNP plan? 1 out of every 2 people you talk to qualify most likely for our heart and diabetes plan. I think it's just asking probing questions, looking at medications to understand, if they'd qualify or not. Underserved population, let's go there. Bullet point number 4. Well, we talked about around 50% qualify for the heart and diabetes plan. If you're looking at our dialysis plan, there are not many carriers in the United States that have a C-SNP plan for individuals ESRD on dialysis. And where those plans are, there's a less than 1% enrollment rate on them. And these are individuals that could use the unlimited transportation. Dialysis covered at 100%. It's just a matter of providing that education to those individuals to let them know that these plans exist and we could be helping them. And we really try to work through our brokers, providers, nephrologists, dialysis clinics to get the word out there so we can enroll some of these patients and members onto the plan. Something I do want to mention, you read so much about C-SNP, and Felipe did mention it. There has been such an increase year over year. There's been a 22% increase in C-SNP plans offered throughout the United States. As he said, I feel like, and I've come from other carriers where there are C-SNP plans, but they look very similar to the standard MA plans. So it's almost like an enrollment vehicle or an election period that brokers can use throughout the year. The gold kidney difference is you're going to see our benefits and plans, medication, everything looks very different than a standard MA plan. It is truly tailored towards the individuals joining our plan. So just big opportunity in both states to help your chronically ill client base. Do you want to talk a little bit about Arizona? Yeah.
Yeah. I'll go over Arizona right now. I
Yeah.
do want to go over the chat real quick, just so everybody can
Sure.
like listen to some of the answers that we have. So first question is there coverage for Mayo Clinic in Duval County? I'll let you answer that, and it's going to be the same in Arizona.
Yeah, so Mayo Clinic doesn't really, in general, work much with Medicare Advantage plans or Medicare, but we are going to get to this. So you are guiding us along the right path here. Any of our members that need any sort of transplant care have access to what we call the Optum Centers of Excellence.
Mhm.
So any transplant care needed, they could go to the best of the best facilities. Mayo is on that list, Cleveland Clinic, Shands, all the best of the best facilities. And we have that slide in here, but send the list out to you as well. So they have access to Mayo for transplant care.
And it's going to be the same in Arizona if you have that same question. We have the Optimum Centers of Excellence. So thank you, Katie. The next question is, can I get a copy of these advertising flyers? I'm not sure if you're referring to the slides, which we will send out, but Katie does have amazing flyers for agents out there, so she can customize them for you as needed, as well as I do if you want to sell anything in Arizona with Arizona specific benefits on it. So we'll give you the slideshow and then also some flyers if you want some as well. And then the last question is this hereditary? As Katie mentioned in one of the slides, 70% of the cause is through either diabetes or high blood pressure, right? That means 30% is caused for other reasons. You have a few different things. Acute kidney injury, AKI, which could lead to short-term kidney function loss. Sometimes it leads to all function loss. Your kidneys are one of the first things to go in terms of your organs. If you go through any kind of traumatic event, you'll see people that run ultra marathons will sometimes go through kidney failure temporarily because they're overworking their body, right? But to answer your question specifically, there's a lot of hereditary conditions that could cause your kidneys not to work. You could be born with one kidney only, which happens. Some people don't even realize it. You can be born with no kidneys or non-functioning kidneys, which means you're on dialysis, from the beginning of life. So there's a lot of things that could lead to chronic kidney disease. The majority of it is caused by diabetes and having high blood pressure, which brings us to this next slide right here. That's one of the crazy facts, right? Like I just said, one of the biggest leading causes of having kidney issues is hypertension or high blood pressure. About half of those that are Medicare eligible in Arizona have that, right? So that means they're on track to developing chronic kidney disease and progressing through those diseases. Around 20 to 25% in our state of Arizona have diabetes, which is insane. And then you could see, heart failure is around 10% roughly. Atrial fibrillation or AFib is one of the something that would qualify you for cardiovascular disease. You have between 5 and 10% people here in Arizona. So all that to say is when you talk to people, about half of them that you talk to will probably have one of these chronic conditions that would make them eligible to enroll in one of our plans.
Mm-hmm. And Florida is very much similar. I mean, AFib, you're looking at 10 to 12% here. Diabetes is more prevalent in Arizona, my goodness, but we're still looking at, 20 to 30%. But hypertension, again, through the roof. So it's just, again, looking at medications, asking probing questions. Also, if you're meeting with the client and there's a question as to, oh, do they qualify? There are so many conditions that fall under cardiovascular disease specifically. So if you ever have questions, you can always text your market manager, text us, and we'll work with our clinical people to reassure you, if they qualify or not. But yeah, throughout the state, just a lot of opportunity. I mean, many of these individuals are just on a standard MA plan. So enrollment into CSNP plans has grown over 67% in the last year, but even with that, only 3.8% of Medicare eligibles are on a CSNP plan. So there is still, when you think, oh, up to 50% qualify, there's still a lot of opportunity to help people with these plans that are truly tailored towards their needs. And we'll send these slides to you. I do like to point out, there may not be as many Medicare eligibles in the internal counties like DeSoto, Hardy, Henry, Okeechobee, but there's a higher instance of chronic illness out there. And a lot of times, as you know, people are more income challenged as well in some of those rural communities, so they may qualify for our Medi-Medi look-alike plan. Do you want to cover this, Felipe? Just the two different types of plans again? Sometimes we have to tell you guys 2 or 3 times what we have and it will stick. So we're going to go through this one more time.
Yeah. So there's 2 different types of plans, right? If you look at CMS's website for chronic conditions that you could build, a plan around, like we said, there's the dialysis plan. I'll start there just because that's the only one it covers. So you have to be on dialysis in order to be on that plan. That is the qualifying condition or the qualifying factor. Then there's another plan within the same category, which is the complete plan, which is for those that have Medicare, Medicaid. Now, the one that is has the name described in it but doesn't have every condition is the Gold Heart and Diabetes. This is congestive heart failure. This is diabetes, and this is cardiovascular disease. Even within there, cardiovascular disease specifically, there's a few different subcategories like AFib that may give you the indication that somebody is qualifying for that plan. So if you're ever in doubt, we have great clinical staff that help us answer some of these questions that even after 2 years of me and Katie being here and watching a lot of House, The Pit, and what's that other show? The
Grey's
um
Anatomy.
Grey's Anatomy. There's still things that we can't answer, so we have plenty of support to answer your questions, which is I think something that's great that you don't see from other health plans, being able to ask basically clinical level questions when enrolling somebody else in the plan. So those are the four different categories broken into two different product types and in four different products total. So
Yeah. And if there's questions, let us know.
yes.
So I'll cover a few of these. So these are plan features within all of our CSNP plans that we feel set us apart from some of the other plans out there. First of all of our plans are in HMO POS. If you don't know what POS stands for, it stands for point of service. It means out of network. Now, there are some POS plans out there where carriers say you can go out of network on this HMO POS, but only for this specific amount of services or these specific benefits. With Gold Kidney Health Plan, our HMOs, first of all, they have no referrals necessary. So they don't have to get a referral at all from the PCP to go to a specialist. Okay, it's a very friendly HMO, we say. But with that point of service, they can go in or out of network for every core benefit on the plan at the same out of pocket. So, as other plans, our PCP copay is $0, and that's in or out of network with no referrals. The key is, like any other type of plan with an out of network benefit, to set your client up for success. If the provider is out of network, you will want to call ahead of time just to make sure they're willing to build a Medicare Advantage plan out of network. And if they are, we pay 100% of Medicare allowable and within a pretty quick time frame to our providers. So HMO point of service plans, no referrals, in and out of network at the same cost share. Something else we do a little different. Not only are our PCPs a $0 cost share for our members, but to see their key specialists that they see most frequently: cardiology, cardiovascular surgeons, endocrinologists, nephrologists, vascular surgeons. There is no specialty copay. It is $0 in or out of network with the POS benefit. And you'll see any other specialist, like a dermatologist, for example, will be like a $10 or $15 copay, super low. So we're trying to give our members these benefits, these great benefits, and more access to care, because you see some really strict HMOs out there that like offer you the world, and then you have this tiny little pod network and you can't even use the benefits anywhere. So access to care is important for us. We're going to talk about some of our innovative benefits on the next slide. Something else to mention is our healthy food allowance. Food is medicine, right? And a lot of our members struggle with high medical costs, along with inflation. I mean, the cost of groceries has really skyrocketed. So we do have a healthy food allowance on all of our plans as well. In addition, transportation is important. On our heart and diabetes plans, you're going to see most of the time we have like a set amount of rides on those plans, maybe a fuel allowance here and there, which will go through the plans. But what's most important to us for our members that have ESRD, they're on dialysis. On many of our plans, we offer unlimited transportation. Again, they're going multiple times a week and they really need that. As far as our drug coverage goes, some things changed this year. We had a lot of carriers added split tier deductibles to their drug portion of their plans. We have no deductibles for any tier of drug. So coverage from day one, very affordable co-pays, which we'll go through. And for insulin, again, we cover all formulary covered insulin, brand name or generic, at $0. So that saves, most carriers charge 35. That saves a little bit of money as well. And as Felipe mentioned, we have different care management programs. through different partners, but on all of our CSNP plans, we still have Papa Pals, which is that companionship program, 60 hours a year, where a companion through Papa Pals will go to our members' homes and help with things like light chores, play board games. We did have a question. They will not do manual labor. We had a question come through. Will they clean my pool? Will they mow their lawn? Nothing as serious as that, but little things like helping you empty your garbage, that type of stuff. But it's very helpful to have that included. I am going to let Felipe talk about some of our innovative benefits that have been super popular this past year.
Yeah, absolutely. And right before I get to those, I'm going to answer some of the questions that were in the chat,
Sure.
just to the group. So the first one is their coverage for under 65 non-Medicare persons. So a few things there. If you are a full-blown ESRD, you would be eligible for Medicare after the fourth month of on the fourth month of dialysis, right? So that is something that you'd be eligible for if you are needing dialysis. But if you are looking just for coverage overall, there's a few different options. You have Medicaid, you have a few Affordable Care Act, what is it called? The
Yeah.
marketplace available to you. And then if you don't have any documents, I don't know, or any papers, I don't know if you know that you can go to some of the health plans directly and purchase some of the plans that are on the marketplace. You just don't get any subsidies. So there's a lot of options out there. For us, we just covered those that are Medicare eligible. And then the next question, Katie, was Justin told me once that even PCPs are out of network, right? And are covered. You covered that in the last slide. Yes, you could even see your primary care doctor through our POS system. We'll pay them 100% of the Medicare rate. So I think a lot of them would be happy to do that. So okay, let's go over these benefits real quick. Really excited when we came out with this last year and started promoting these. We have Thrive Mobile, which is a free cell phone and data plan that's unlimited talks, text, and data available to our members. It doesn't just provide a cell phone. It provides other levels of service like having you as a broker of record on there so that they know who enrolled them and how to get a hold of you, which helps you retain your book of business. A few other things is we pre-download our application. So Allevi is pre-downloaded, the Gold Kidney Portal is pre-downloaded. And we have weekly check-ins with them. So there's just a quick questionnaire that they could skip if they wanted to, if they find it like not useful to them. But this allows us to kind of check in to make sure that they are doing okay and give them guidance on what to do if they don't if they aren't feeling good or they haven't gotten their flu shot or what have you. So some really cool things that we can do when we partner with a company like Thrive. Addition to that, we have our Allevi vendor, which does a few different things for us. They provide our OTC and Gold Perks benefit. So you'll know that that includes things like utilities on the Gold Perks Plus, a few other things available as well as OTC. They provide on that same card dental, vision, and hearing through a flex allowance. So the amounts are different on each plan, but it's really nice that you can mix and match what you want to use those benefits towards. And then they also provide transportation, as well as a gas and ride share debit card, which again is that same card providing the Gold Perks program, providing the OTC, providing dental, vision, hearing, and gas and ride on select plans. So look out for that when we go over the plan benefits later on. Allevi is a huge vendor for ours and great partner. And then the last thing is some of the things that we do around transplant benefits are very it's something that you see that we put a lot of attention towards. If you are going up for a transplant, I don't know if you know, but there is a requirement that you have somebody to take care of you after the transplant. So we provide a benefit for that. Also, pre-transplant, you've got to make sure that you have good dental health. If you don't, we'll provide $500 extra towards a kidney transplant to fix whatever dental issues you may have to make sure that you're not being disqualified from the transplant list.
Awesome. And a broker, they were right on track mentioning the Optum Centers of Excellence. So we'll send this out after, but it really just lists between Arizona and Florida. some of those amazing facilities that our members can get transplant care at. All right, market specifics. I promise you we are not going to read line by line, but we are just going to highlight some of the benefits high level on the plans within Florida and within Arizona. So this kind of gives you a map of Florida, all the counties we're in, and it's letting you know what CSNP plans are offered. So one county always has to be different than the others in Florida, and that is Miami-Dade, right? So Miami-Dade has some carved out plans, but in what I call the rest of Florida, which is Broward County North, the plan numbers and the plans are pretty much the same. So in the rest of Florida, we have Gold, Heart, and Diabetes. Miami-Dade has their own version. We have Gold, Heart, and Diabetes Complete. And again, it's a C-SNP plan. They have to qualify through the different conditions mentioned, but it is tailored and geared towards those with that are full Medi-Medi. So the Gold Heart and Diabetes Medi-Medi plan, the CSNP plan, Salud de Oro, it's in all counties, including Miami-Dade. And Miami-Dade has the top enrollments into that plan. Just some knowledge there, but we do pretty well throughout the state. Gold dialysis in all counties except Miami-Dade. The Gold Dialysis Complete for Medi-Medis is also in Miami. It's in all the counties. And then in Miami-Dade, they have Salud de Oro. That is their heart and diabetes plan specifically for Miami-Dade because with some, you know how it is down there. It's very competitive. So we had to lower the MOOP and the cost shares on those plans to be in there with the rest of the market. And then we have Dialysis de Oro, which is the dialysis C-SNP plan specifically for Miami-Dade. So looking at Gold Heart and Diabetes, which is in the rest of Florida, Broward County North, some highlights on this plan. Again, individuals have to have Medicare. They have to qualify with one of the conditions listed and that we've discussed. One thing we didn't tell you is some of our plans actually have Part B givebacks. You know, we have all these other exciting benefits, and sometimes we forget to talk about that. The Heart and Diabetes plan does have an $120 a month Part B giveback on it. The MOOP is right in line and very competitive with some of the other plans out there in Florida. It's at $2,700. You are going to notice the PCP as well as those key specialists, like we mentioned, there's a $0 cost share. And again, with the point of service, that's in or out of network. Any other specialist is a $10 copay. Hospitalization, $150 a night, up to 5 nights. I'm just highlighting some of the majors here. You can look at this after when we send it out. Lab work, $0. Now, just for you Florida folks on the phone today or on the call today, LabCorp is our network lab, but we still have plenty of people that go to Quest. And since there is that point of service benefit, Quest is still $0 and when they're billing us. Dialysis is 20% on this plan. Why? Because if somebody's on dialysis, they should not be on this plan. They should be on the dialysis plan where there's no cost share. You can look at the drug coverage. Again, no deductible. Our members can either go to one of the 65,000 pharmacies within our network, or they can use Birdie, which is our 100-day mail order program, right? Just so the doctor writes the script for 100 days. Something I'll mention is for those tier 3 medications that many of our members use. Ozempic, Trulicity, Mounjaro, those extremely expensive medications. Through mail order, our members just pay one copay for an 100-day supply. So that's pretty amazing on our plans. And we save people a lot of money. What people really like to look at are the extras on our plan. Felipe mentioned when people join our plan, they have a Gold Kidney membership card that they show at the doctors or the pharmacy, but then they have that Allevi Visa card. And any of the benefits that we talk about right now with monetary amounts, those are the benefits loaded onto the Allevi Visa. They swipe it and use it. So for dental, hearing, and vision on this plan, it's a quarterly benefit, but if you look at it for the year, it is a $2,800 annual amount on that card. And it rolls over quarter to quarter, but they have to use that benefit, the $700 a quarter by the end of the year. Again, smartphone with unlimited talk text data. The food allowance ends up being $1,008 a year. That one is broken up monthly. 24 one-way trips. The Gold Perks Plus, they receive $25 a month on the Visa to use towards utilities, OTC, pest control, a variety of items. We do use Silver and Fit for our gym membership. Papa's Pals, 60 hours a year. Personal emergency response system. We don't we a lot of carriers work through another vendor. We work through Connect. What is it called, Felipe? Connect One or Connect? I'm having.
Now I forgot. Connect America,
Oh
I
my goodness.
think.
That is awful. Connect Health, but basically what's different about it, it's really cool. They can have a pendant or a bracelet, and when they press the button, there's actually a live attendant there that could call the ambulance, but they can also call a family member, the doctor. So it's a little more personalized. And then we do preventative rewards as well. So this is the Gold Heart and Diabetes Plan. And guys, remember, up to 50% of the individuals on Medicare that you speak with qualify for this plan where it's available. And then, of course, Gold Heart and Diabetes Complete. For since these, you only sign somebody up on this plan if they have full Medicaid, so they have cost share protection. They would be the 0% on the left-hand side. So just so you enroll people with those chronic conditions that are full Medi, they pay zero for their core benefits. For drugs, they're going to pay their LIS amounts. And then you can see the extras. We amped them up a little bit. 3,800 a year for dental hearing vision, 2,100 a year for healthy food. They receive a $300 fuel allowance plus 23 one-way trips. So basically, if you're somebody out there that offers some of the D-SNP plans out there, this is a C-SNP plan that competes with the dual plans out there. And you really need to break our benefits down that are listed, and they are competitive. In addition to that, our members, they don't just get a once a year visit in their home. They're entitled to dual health, many of them, where they have a care team of a nurse, a social worker, and a care navigator that live in their local community and can go into their homes much more often. So a lot of extra TLC. My favorite plan, Gold Dialysis, for individuals on Medicare that are on dialysis due to ESRD. Highlight the biggest highlights here. It's very similar to the heart and diabetes plan. There is no give back on here because we cover dialysis at 100%. They are no longer responsible for that 20% like on a standard MA plan. They see their key specialists at zero, no deductible on the drug coverage. And again, they get all these extras. And in the interest of time, I won't read through every single one. Healthy food is important. That unlimited transportation, not only do the patients and the members appreciate, but the social workers at the dialysis clinic appreciate this because this transportation is something that these patients and members struggle with the most. So just having that transportation is huge for these members. And then we have Gold Dialysis Complete. And again, this is for individuals on dialysis that also are full Medi. They pay zero for all their benefits, and then we amped up the extra benefits a little more
Katie,
for
in
them.
Florida,
Yeah.
the question is, do you consider QMB full?
Yeah. So if you look in the evidence of coverage, it will tell you QMB does have cost share protection. So QMB plus, SLMB plus, and FBDE would be the levels that you would put on a complete plan.
And that's the same for Arizona.
So they get all these extras. Again, it is somewhat competitive with the dual plans out there, but they get that extra TLC, through care management and the company as well. For you Miami folks that do business down there, this is our heart and diabetes called Salud de Oro in Miami. And you'll see great plan. It's very competitive. Zero premium. The MOOP's lower than in the rest of Florida, 1900. The copays are lower, 0 or 5. Hospital's only 50 a night. Drug coverage is very similar. There is no deductible. They could do retail or mail order. One copay for a tier 3 for an 100-day supply through the mail order. And they get all these extras. A little more in Miami. They get 1,056 on the healthy food. We do 24 one-way trips plus a $900 fuel allowance or ride share. They can use it towards like an Uber, for example. Gold Perks Plus, the companion care, very competitive. And we do, in Miami, everything is like relationship provider based. We do work with several MSOs down there, and we are really increasing our network there and throughout the state. And then dialysis de oro is Miami's version of the dialysis plan. And again, copays, MOOP, everything's a little bit lower, and the extras are amped up a little bit to be more competitive down there. This one, for example, 72 one-way trips, plus they receive $1,200 a year in the fuel allowance on their Visa card. So I want to leave Felipe some time. I'm kicking it over to you, Felipe.
Thank you.
Mhm.
Absolutely. So this is what Arizona looks like. Like I said earlier, we're in 8 different counties. You'll see that the plans are separated by the rural and urban areas, kind of what we consider it. So you'll see the ones in blue are Gila, Maricopa, Pimo, Pinal. Those are the ones that are going to be grouped together. And then you'll see Cochise, Coconino, Graham, and Navajo grouped together in our product structure. So just know that they cover different areas, and gold heart and diabetes in the urban area is going to look different and have different benefits than the gold heart and diabetes in the rural area. So this is going to be one of our main plans that we have that we sell a lot of here in Arizona. It's the Gold Heart and Diabetes, provided specifically in Maricopa County. That is our biggest county by population, so it makes sense that it's our best seller, and it's a very competitive product in a very competitive market. So maximum out of pocket is $2,500. You'll get dental, vision, and hearing, $4,000. We see a lot of agents out there working with dental clinics to utilize those benefits. Of course, you get the cell phone because it is a C-SNP plan that we have. And then you get healthy food on this plan as well. $924. One thing that I like to point out is we have $300 for our preventative benefits. That's pretty good. Some of the carriers here in Arizona are only at like 150. So, these preventative rewards are things like going to get your flu shot, going to get a mammogram, doing your yearly visit with a doctor. All of those things contribute towards that. And again, it's on that one Visa card through a Levy, which is really nice that it's all consolidated to just one card. I worked at a previous carrier and there was like 4 different cards and then your ID card you had to worry about. And that's not fun for the members. So I like the way that we do it here. And then the next plan is our Gold Heart Diabetes plan. Again, this is for the Medicaid population that have Medicare, and they have this chronic condition. As you know, there was a lot of DSNP regulation put in place this year that restricts when you could enroll, and also who you can go to in terms of alignment of your health plan. Given that we're a C-SNP, we're kind of outside of that, and they're enrolling not to another D-SNP, but a C-SNP specifically plan. So they can enroll at any time of the year. So if you have a Medicare and Medicaid person that needs to move their health plan for whatever reason, whether that be a doctor or just certain benefits, they could do that with this plan. And we feel like they're very competitive. Dental, vision, and hearings, 4,000 for this plan, which is really competitive. $1,800 for food. If you combine that with the Gold Perks allowance, we're actually ahead of a lot of the decent plans here in Arizona. And in addition to that, here in Arizona through Access, or otherwise known as Medicaid, they get unlimited transportation. We'll give them additional 24 one-way trips, especially for these ancillary benefits that are not covered by Medicaid. They'll be able to use those trips towards that, and then a $300 fuel card for the ride share or fuel, which is really, really nice for them to have that option. And then our dialysis plan, obviously a staple of ours, given our name Gold Kidney. And I think the biggest value proposition that we have here is the transportation offerings. Here in Arizona, we have 200 one-way trips on this plan and a $600 ride share allowance. As you know, Arizona's big, it's concentrated, but people that do live in the rural areas need to travel a lot. And that's why we felt like adding a fuel card to this plan was very important to us. Also, the $0 for dialysis is why you would want to be on this plan as well. We kind of think of it in 3 different categories when we're talking about this population. What are their biggest concerns? The first category is going to be transportation. That's their biggest concern a lot of the times because they're trying to go 3 times a week, 52 weeks out of the year. If not, they go to the hospital. The second thing for them is nutrition. They can't eat just any food. They can't have high potassium foods. They have to be very careful with what they intake into their body because their kidneys are not filtering things out. So with that, food is a big concern. And the third thing is cost, right? That's really important to them. So that's why our Dialysis is at $0, and those key specialists like an endocrinologist, nephrologist, cardiologist, and vascular surgeon are all at a $0 copay. And then our gold dialysis is complete. Again, this population gets transportation through their Medicaid plan, but we still provide a $720 fuel and rideshare allowance. When we say rideshare, that includes like Uber, Lyft, Waymo. Out here in Arizona, we have those self-driving cars. So not sure how confident somebody is with those, but that's an option for them. And then 61-way trips. Again, we provide a pretty healthy amount of food benefit, again, surpassing a lot of the Medicaid plans here in Arizona. And then dental vision hearing at 4,000, which is very competitive. And then we have a rural plans. And this is where by numbers, it may not seem too crazy, but by proportion of the state, Navajo County, which doesn't have very many people in it, is one of our best-selling plans. This one specifically in Navajo County, just because there's not a lot of options out there for those people. So the fact that we have a plan that would be competitive here in the Maricopa or Phoenix market up there means that we're just selling this product left and right for those that live in these rural counties. So again, $2,800 for dental vision and hearing. It includes a smartphone, which is really important for those that live in the rural areas. Healthy food at $1,044 a year. And then providing exclusively a fuel rideshare allowance, given that transportation infrastructure may not be out there in the rural areas. So, and then combine that with a maximum out of pocket of $2,750. I mean, there's very limited plans to begin with, and none of them are very competitive just because of the market. So, we feel like we have a very good upper hand in the rural counties in Arizona. And then this is the gold dialysis plan again for those counties: Cochise, Coconino, Graham, and Navajo. Again, with a low maximum out of pocket of $2,900. There's not a lot of options, especially when you're on dialysis. So the fact that we're able to provide $900 for fuel and rideshare allowance, provide food for these people, provide a cell phone, especially for those that are using transportation or getting picked up for scheduling appointments. They can't just go down the street and schedule an appointment if they can't talk to somebody at the provider office because they're 30 miles away in the next town. So having a cell phone available to these members is really important. And then providing dental vision hearing at $2,000. Again, that the gold dialysis plan is just as important in the rural areas. And then I think I see a question. Let's answer that real quick. Kate, you want to take this real quick while I go through the chat?
Sure. All right, great. So if you're newer to C-SNP plans, something that CMS requires is that when a member enrolls into a C-SNP plan, the carrier needs to verify that they have the chronic condition that they enrolled for within 60 days of the plan effective date. So again, when you enroll somebody, it's important you ask the right questions to do everything you can to make sure they have the actual condition that qualifies them. With Gold Kidney, you'll notice that we have our enrollment, but prior to the enrollment, and by the way, Evolve is our system that our brokers use, but we are on Connecture, and as of just a week ago or so, we are on the Sunfire platform as well, which we are so excited about. But we have in our enrollment process what's called a PQUAT, and that's a pre-enrollment qualification assessment tool where a few questions are asked to determine if somebody has diabetes, heart issues, if they're on dialysis. So it really guides you towards what plan to put them on with us. So you'll notice those questions when you enroll somebody with us. And if there's any questions as to our enrollment process, let us know. But once you put that enrollment application through, again, we have 60 days to verify that condition. So what we do is when you fill out the enrollment form, you type in the name, or hopefully you're doing an electronic app. So you type in the name of the physician that can verify their diagnosis. We as a carrier reach out to that physician, but we also provide you, the broker, the PDF that we need sent in from that physician, just in case we're having a hard time getting a hold of them. Within 30 days, if we're unable to verify the condition with the physician, CMS requires that we send a letter to the member saying, hey, it's been 30 days. Within the next 30 days, if we are unable to verify your condition, you're going to have a SEP to join another plan. And we keep the broker involved along the way. How it's been working, a lot of times we are able to verify it within 30 days, but if we're not, the market manager, like if you're in Tampa, Justin will reach out to you and say, hey, we're not able to get a hold of this doctor. Can you help us out? And between the carrier, the broker, and the member, we get 99% of the verifications and usually. But if for some reason within 60 days we can't verify it, again, you have an SEP to move your member to another plan. Broker experience, we'll send this out. We're kind of going over here, not kind of, we are. So I'll summarize this and we will send this out. Felipe and I were talking about some of the key brokers we work with. We call them our dream team, and what they do to really bring in enrollments on the CSNP plans. And we always say think CSNP first. A lot of brokers, they don't ask those probing questions, or maybe they don't represent a CSNP plan. And it's really, if you don't have CSNP plans within your portfolio, you should really think about doing that. And of course, coming on with Gold Kidney, because up to 50% of your clients qualify for our plan. So ask those questions. If they don't qualify for a CSNP plan, then look at your standard Medicare Advantage plans. Provider engagement, we not only work with PCPs, but we have great relationships with nephrologists, cardiologists, and endocrinologists. So it's really developing relationships with some of those specialty doctors where their patients could benefit from being on our plan. Dialysis clinic engagement, that takes some work, but we have 275 dialysis clinics in Florida. Felipe has just about as many in Arizona in the network as well. Where we walk into those DaVitas, those Fresenius, those ARCs, and we really try to educate the insurance coordinators and the social workers, and a lot of times do lunch and learns to let them know how we can help their patients. Being out and about in the community and really looking in your own book of business. Look through your clients. Do you remember that somebody's on dialysis? They're on insulin. They take Ozempic and they're paying quite a lot of money for it. Be thoughtful, and if there's anybody in your book of business that could benefit from being on our plan, maybe have that conversation with them. And we have a lot of marketing materials. Just reach out to your market manager and we can get you what you need. We support you at the local level, but we also have what we call Gold Bar, which is our national broker assist and resource team, where you can reach out by email or by phone, and they'll answer questions on contracting, system support, enrollment support. We're here from you at a national level down to a local level. And then I mentioned Evolve. Evolve is our one-stop shop for agents, where you have a dashboard. You can look at your book of business. You can initiate an enrollment from there, look at application status, do an HRA, which we'll talk about in a second. So if you ever need help with Evolve or you're having issues navigating it, reach out to us. We're happy to help. Training. We're getting our website up and running again. We've made some changes, so you'll notice the trainings aren't on there right now, but they will be soon. But our market managers send out invites. In the market, we do a lot of Gold Kidney overviews, a lot of coffee and chats. Every single Wednesday in Florida, and I know weekly in Arizona too, they are out and about. We want to meet with you and educate you on our products and really come up with some business plans as well of how we can work together. So we hope to see you at some upcoming trainings. Talking about that, again, first looks, we're going to be sending the dates out soon. Those are going to be in August. We'll be doing our rollouts throughout September in both states. Some of you are probably having fun on AHIP already. I have to do that this weekend. But Gold Kidney certifications, our target date is to have those out around July 1st. So you'll just have to upload your AHIP certificate, take our modules, which are not too torturous. They're maybe 15 or 20 minutes. And if you certify for 2026 and you're not yet with us, that will cover 2025 as well. And Felipe, I'm going to let you talk about the HRAs.
Yeah, absolutely. And then just to piggyback off of your first look comment, somebody asked Florida expansion counties for 2026, question mark, do you do you have Millennium Physician Groups or 2025 or 2026 for Florida counties, Sarasota Memorial? I'll maybe let you answer that, but also think that that's a good call to action to find out more of what we're doing for 2026 at our first looks. Would be excited to
Yeah.
have more information when we're there.
Yeah, we'll have more information there. As far as the network goes, we've had so many great network ads in the last 6 months in Florida. And we're working on others that we'll announce soon. Unfortunately, Sarasota is a challenging area for us. If you know the area, it's kind of tough sometimes to get that contract with Sarasota Memorial. They're always on our mind. We will keep pursuing it, but as of right now, we don't have Sarasota Memorial. We have all of the HCA hospitals throughout the state, and in Sarasota, we have the HCA affiliated hospitals. So work in progress there. Millennium, we know Millennium is very important, not just in the greater Tampa Bay area for us, but up into Jacksonville market. And I know they're expanding all over. So they're on our list. We've talked with them. Nothing has come to fruition yet. In that greater Tampa Bay area, though, we did add recently Tampa General Hospital, Orlando Health, Moffitt. We have HCA. We know Baycare is on a lot of people's mind, and that's on our mind too. So work in progress. Always look out at your email because we will blast out to the world when we add important providers to the network.
Yeah. And then so copay for Ozempic on our Arizona products tier 3, $40. Katie, yours is the same?
Yeah, $40 for an 100-day supply.
Perfect. And then $300 for CSNP HRAs. So that is huge. I mean, that's almost as much as the amount that you can make on the commission. And then if you get a dialysis person on our plan and you do the HR to completion within 14 days of enrolling them, that's $400, which is amazing. So
And I
yes,
will,
Arizona and Florida, Norm.
yeah, and I
Zero
think,
dollar,
oh, sorry.
sorry, $0 copay for Ozempic if that's what you're asking.
Yeah, and on that, back to the HRAs quick, because I know a lot of individuals on this phone use the Sunfire platform, right? Some might use Connecture. If you use Connecture or Sunfire, once you submit the enrollment application, as it stands now, you have to do HRAs through our Evolve portal. So it will take about 2 business days for your enrollment from Sunfire or Connecture to show up on the Evolve platform. And then at that time, you can go ahead and complete the HRA. We give you 14 days from enrollment to complete the HRA. So that's just a heads up kind of how that works, because I know a lot of you do use Sunfire. So I think we went over a little bit, but we hope that you learned something today. We hope to partner with you all in 2025 into 2026. We really feel strongly that we have the plans, the benefits, the services, the care management available where we can really help improve the quality of life for your chronically ill clients, and hope they become our members someday. So are there any other questions that we can answer at this time? Felipe, do you see anything?
Not yet.
I see one in the regular chat. It's
Oh,
asking where
chat.
can they access the calendar for Wednesday in-person development?
Gotcha.
Where, Suzanne, may I ask where you're located? Like what county? I'm gonna have the market manager reach out to you and provide. Oh,
Pinellas.
perfect.
No, yeah.
I have your name down. I'm gonna have, hopefully, I'm not sure if you're contracted with us yet. I'm gonna look in the system, but I'm gonna have Justin Hall reach out to you today and provide some upcoming activities that he has going on. Oh, nice. So we will also be at the at work event on Friday, Justin and myself, so we can meet you in person as well. So we'll have that information there too for you. Awesome.
Awesome.
Is there any more questions before we end the call? All right. Well, I want to Oh, no, there's nothing. Okay. Well, I want to thank everyone for taking the time out of their day to join us. And thank you, Felipe and Katie, for sharing this information with us today. And again, like Katie just said, join her and Justin this Friday at the At Work Network event over at Safety Harbor Spa at 12:30. And if you'd like more information about the event or to get appointed with Gold Kidney, please reach out to our office at 800-662-5080. And I would like to thank everyone and have the rest of a great day.
Thank you.
Thank you.